Hello, good day everyone. You're welcome to my YouTube channel. My name is Pharmacist Good Luck, but you can call me Oyibo Pharmacist. So today we are going to look at the 6 common causes of joint pain. A lot of you have joint pain, but you don't really know what could be the reason why you have joint pain. All you know is that when the pain comes, you go and get pain relief from the pharmacy or from the chemist and take. It subsides. After some time, a while again, it still come back and you still go and buy pain relief, but you don't really understand the cause of this pain on your joints. So in today's presentation, that is what I will be talking about. So basically, for the sake of this presentation, in the body, in human body system, the joints are generally divided into 2 for the sake of this presentation. And number 1 is the movable joints, and then the immovable joints. The movable joints are those joints that can move. You can actually move them up, down, or side view. All right, it can allow those kind of movements. But the immovable joints generally are static. A typical example of immovable joint in the body is the joint located on the skull. All right, so for today we are going to be using a particular example of a movable joint, which is the structure we have on the board, to explain the major causes of joint pain, because it is until we understand the component of the joint that we can say for sure that it is as a result of this that is why the pain is there, or as a result of that is why the pain is there. So having said this, the joint is generally composed of these basic features. However, there are other components of the joint that I did not include here. This is not a comprehensive structure of the joint showing its components. So a joint basically is a place where 2 bones meet together. Okay, so a joint comprises of the bone, which we are seeing there on the board, the bone, or rather the bones, which is this and this, okay, the ligament. And the basic function of the ligament in the joint is that it helps to keep the joint in place. It helps to keep it in place so that excessive movement will not actually cause dislocation, cause this bone to shift from its original position. That is the function of this ligament that we are looking at here. So apart from the ligament, we also have the cartilage. This cartilage is not just cartilage, but it is called articular cartilage. Okay, the articular cartilage is the cartilage that line the surfaces of the bones that are in the joint. Okay, so the function of this articular cartilage is that it acts as a shock absorber. Okay, so we all know our motorcycle, it has a shock absorber. So the function of this shock absorber in the motorcycle is that when you are on a high speed or even a low speed and then you jump a bump or a pothole, this shock absorber will now, it's like a spring. It will just move down. It's going to reduce to cushion the effect of this bump that we just jumped. So the same thing is applicable to the articular cartilages in the joint. The function is that they act as shock absorber. So what they do is that they help to reduce the friction between these 2 bones. So definitely this is a joint and it's a movable joint. So they usually move against each other at every point in time. But instead of these 2 bones rubbing against each other directly, it rubs the articular cartilage, cover them so that they will be rubbing against the articular cartilage, and this articular cartilage reduces the friction. It acts as a shock absorber, reducing the pain that would have come as a result of these 2 surfaces of the bone rubbing against each other. Now, having said this, apart from the cartilage, we also have the synovial membrane. So the function of this synovial membrane here is that it helps in secretion of synovial fluid. These fluids that you see inside the joint cavity. Okay, now apart from this, we also have the synovial fluid, which is the fluid that the function is that it acts as a lubricant in order to reduce friction between these 2 bones. Just like your machines, heavy duty machines, where 2 ions are moving against each other. What we normally do is to do what people that operate this machine, what they normally do is to add oil to it, a grease, to reduce the friction, so that the friction between these 2 ions will reduce. The same thing is applicable. It's natural. God created it that way. So the synovial fluid is there to reduce the friction between these two bones. So having talked about the basic components of a joint, now we are now going to talk about what could be the reason why you have pain on your joint. Okay, so there are quite a good number of things that can make you have pain on your joint, but for the sake of this presentation, we are going to look at only 6 of them. There are about like 15 of them. There are a lot of them, but the most common one that we're going to be discussing today, there are 6 of them. And number 1 is dislocation. You see these bones here, these 2 bones here, God created them to be in a particular position. So if by any reason at all that these 2 bones, one of them loses the natural position where it's supposed to be, maybe because of excessive physical activity, movement, there is a shift in this joint. That is what is called dislocation. And once you have dislocation, even if it is a little shift, of course there is going to be pain until this bone that shifted is brought back to its original position. That is the only way that the pain will go, of course with the use of other pain relief and all of that, just for temporary relief of pain. But if the position of this joint, of this bone, did not come back to its original position, of course the pain will always be there. So number 1 reason why you have pain on your joint is because of this bone. It has been what? Dislocated. Apart from that, number 2 is this ligament you are seeing here. Could be the reason why you have joint pain. Okay, so these ligaments, remember, they help to hold these 2 bones in place, to hold your joint in place. So if by any means, probably as a result of excessive physical activity, exposure to external pressure, this ligament got injured. So if this ligament here got injured as a result of overuse, maybe it twitched, or maybe something like that happened to it, ligament injuries, it can also be the reason why you have pains on your joints. Okay, so this is the second reason why you have joint pain, that is ligament injury. Okay, apart from that, number 3 is this your cartilage. This your cartilage here, articular cartilage. So this articular cartilage, we have stated the function that they act as shock absorber, all right, reducing the friction that exists between these 2 bones. So research has it that as one ages, over time, over a long period of time, this cartilage naturally begins to wear off because they have been rubbing against each other for quite a long period of time. So they begin to wear off. These 2 cartilages here that are, you know, covering the bone, they begin to wear off. They begin to wear off. They begin to wear off until they now start exposing the surfaces of these bones to each other. All right, they now start exposing the surfaces of these 2 bones together, and when these 2 bones are now exposed to each other, it means that any movement at all, of course, is a movable joint. Movement will always be there. So this movement will now cause the surfaces of these 2 bones to be rubbing against each other, and when these 2 bones are rubbing directly against each other, it will bring about pain. So this kind of condition in which these cartilages wear off, you know, over time, is called osteoarthritis. So number 3 reason why you have pains on your joints could be because you have a condition called osteoarthritis, and this is most common among our old mamas and our old papas. It is usually age related because it is as a result of prolonged use of these cartilages that are located on the surfaces of the bone. So number 4 is another condition that is called rheumatoid arthritis. That is number 4. Okay, so rheumatoid arthritis, let me tell you what happens in rheumatoid arthritis. It is an autoimmune disease. Okay, it happens when your own body start destroying your own cells. Just take it for example now that you went for a fight together with your brothers and sisters, and you gave the elder son maybe the gun, so that when you people get there, you people can shoot at sight anybody you see there. And as you people were going, before you even reach the target point where the fight will start, the eldest brother that has the gun now turns against you people and start shooting on you people, start killing you people one after the other. Okay, so blood killing blood. Now, not that this man is doing this thing because he wants to, but because he has a misinterpretation that you people are now the enemy, and then he's now trying to destroy the enemy. That is what happens in autoimmune disease, rheumatoid arthritis. What happens is that your body system will start seeing this synovial membrane here as a foreign tissue, as a tissue that is not supposed to be in the body, as an invader. So what happens is that the body will now start fighting them, start destroying them. This synovial membrane that secretes the synovial fluid, it will start destroying them, to start destroying them. And as it is destroying them, not only the synovial membrane, it is also destroying some other, cells and organs in the body, depending on the position of the body that is being attacked or affected. Sometimes it's the skin, sometimes it's any part of the body. So if these synovial membranes are completely, as it is destroying them, what happens is that this fluid here, because it is the role of the synovial membrane to secrete these fluids to reduce friction, so this fluid will not be secreted properly again. Your joint will be lacking this fluid that acts as a lubricant, or that acts as lubricant. And when this happens, friction will increase. When friction increases, pain comes, and this could be the reason why you are having pain on your joint. So rheumatoid arthritis could be the reason why you have pains on your joint. Apart from rheumatoid arthritis, number 5 is another medical condition called gouty arthritis. Okay, let me explain this one to you. When you eat meat, this meat that you are eating contains a particular product called purine. So this purine, when it gets into the body system, to the blood, it is usually metabolized into a waste product called uric acid. So this uric acid is expected to leave the body, as a matter of fact, and normally the kidney does the role. The kidney usually filter it from the blood and get it out of the body through the urine. So if there is excessive consumption of meat, or a condition in which the uric acid level become high in the blood, this is called hyperuricemia. So when there is high amount of uric acid in the blood, at a point, over some time, at a point, what happens is that this uric acid in the blood start forming crystals. They start forming crystals. They start forming crystals. And then after forming crystals, they are now being deposited in different parts of the body. Okay, some to the joint and then to other parts of the body. So if these crystals that are formed by the uric acid, called uric acid crystal, are now deposited on the joint, when it gets to the joint, of course it is going to cause inflammation, it's going to cause pain, it's going to cause stiffness there, and that is why this can also be a problem for you and why you have pain on your joints. And this condition is called gouty arthritis, or simply gout. So gout could be the reason why you have pains on your joints. So the last but not the least is number 6, infection. Okay, so some of you, when you have infection like typhoid fever or some other serious infection, you start having pains on your joint, and you'll be surprised. You don't need to be surprised, because research has it that infection in the body, different parts of the body, could be the reason why you have joint pain. It can actually cause joint pain, infection in the body. So with this being said, I hope I have been able to expose you to the 6 common things that could be the reason why you have pains on your joints. Okay, pains on your joint. And I have also been able to explain to you the different types of arthritis, common different types of arthritis we have: the osteoarthritis, rheumatoid arthritis, and the gouty arthritis. So that joint pain you are having is not as simple as you may think, especially when there is no physical pressure on your joint. It just develops on its own, or especially when you are old, even when you are young and you started just feeling joint pain over some period of time, you have been taking pain relief and is not going, then I advise you try to find out what is actually responsible for my joint pain. Is it osteoarthritis? Is it rheumatoid arthritis? Is it gouty arthritis? Is it infection? Is it as a result of ligament injury, or is it as a result of dislocation? So with this being said, I would like to say thank you very much for your audience, and I would also like to say that if today is the first time you're coming across my videos, please do well to click on the subscription button. If you have subscribed, I want to say thank you for always coming back to come and see what I have to put forward. Now, with this being said, I would like to say thank you and see you in my next episode.